Hello and welcome to South First. I am Chetna Belgare. Today I am in Sparsh Hospital's RR Nagar in Bengaluru with renowned orthopedic and joint replacement surgeon Dr. Raviprasad. Doctor, welcome to the show.
Morning, Doctor. Namaskar.
Dr. Kattimani, my first and foremost question is, what are some causes of knee pain?
Yeah, it's very relevant question for today's scenario because many of us are now suffering from knee pain. When it comes to knee pain, it depends on the age of the patient and the history. If there is any traumatic history, then obviously there could be some damage to the surrounding ligaments, tendons or the muscles. If there is no trauma, then it could be because of inflammation like rheumatoid arthritis or psoriatic arthritis. And most common cause in the elderly people is osteoarthritis. So these are the various causes. It depends on the age and the history of the presenting complaint.
Okay. So these days, obesity is something which has been the root cause for many such diseases.
Yeah.
So how much does lifestyle actually cause knee pain?
Well, lifestyle is interestingly directly related to the knee problems, especially in the osteoarthritis. If somebody has got a sedentary lifestyle, not having enough activities, then if somebody is taking a lot of junk food or highly processed food, what we call as, these are the direct insults to the knee joint, and they get early arthritis, and obviously they are more succumb to have knee problems.
Okay. Doctor, if you could explain through a model, how do we actually feel the knee pain, and is there any, depending on the location of the pain, can we actually identify the problem of what the knee pain is?
Yes, a very interesting question. Yes, we got a knee model here. So this is the thigh bone on the top, and this is the leg bone, we call it as tibia, and this is the kneecap. I'm just making it upside down. So that's the kneecap or patella we call, and this is the quadriceps tendon, the big muscles in front of our thigh. When the pain is just above the kneecap, it's called quadriceps tendinitis. The tendon insertions gets inflamed. And when the knee pain is just underneath the kneecap or patella, around here, it could be a patellar tendinitis. It usually comes when the person is coming down the stairs. It will be a pain in the front of the knee. That's patellar tendinitis, quadriceps tendinitis. And that's the inside of the knee. In medical terms, we call it as medial side. If the pain is here on this side, it could be because of the meniscus tears, especially in the younger generation, if they have any history of trauma or fall. It could be meniscus tears here, or it could be a sprain in the MCL. This is a big thick ligament which is inside of your knee. If you had any fall or any injuries, that could be a sprain in this ligament, which is most commonly injured ligament in the knee. And if it is on the outside, or we call it as a lateral side in medical terms, again it could be a meniscus tear, and there is a big band here from the muscle, we call it as IT band, iliotibial band. Again, that gets inflamed, especially in the runners. Somebody runs a lot, they get pain on the outside of their knee. And if they have pain all around the knee, all across the knee, or a global pain, it could be because of osteoarthritis. Yes, okay. So depending on the location of pain, we can determine what's the cause for the knee pain.
Okay. So the last one which you said, the osteoarthritis, is something which we commonly hear, and majority of the times they say that it is due to osteoarthritis. Yes. So what exactly is this?
So again, going back to the model, osteoarthritis is, earlier it was called as wear and tear of the cartilage, but recent studies and researchers are showing that it's not just the cartilage, it's the end stage of the systemic involvement of the whole joint. Okay. So the cartilage is here you can see the covering of the bone here is cartilage, that obviously will have wear and tear changes. Along with that, the muscles around the knee joint, the ligaments, the meniscus is like a shock absorber, everything in that joint gets involved. Okay. And they will have some wear and tear changes over a period of time, and the end result is complete degeneration of the covering of the joint, leading to bone on bone rubbing on each other, and that's what causes excruciating or extreme pain. Okay. So that is osteoarthritis.
So many of us, when young people come and say that we have knee pain, we are mocked at and said that, you're so young, why are you complaining of knee pain? So this osteoarthritis which you're talking about, does it happen only in the elderly? Yeah,
I think it's a very relevant and interesting question you asked. Whenever young people complain of knee pain, I strongly recommend that they should never ignore it. because it could not be an osteoarthritis, it could be some sort of inflammatory arthritis. We call it could be a rheumatoid arthritis, or if they have any skin condition called psoriasis, the joint could be involved. It could be a psoriatic arthritis. If somebody is consuming a lot of alcohol, if eating a lot of red meat, then they are more prone for gout, and that could be a gout attack which could destroy the joint. If somebody has any infection elsewhere, their knee could be involved in a secondary infection. We call it as a septic arthritis, and that could be a life-threatening scenario. So any joint pain in younger people, especially if they've got multiple joint pains, swelling, fever, feeling unwell, they should consult a doctor, and it's not osteoarthritis all the time, especially in the younger generation.
Okay. So is osteoarthritis even preventable? Is it preventable?
Yes, definitely it is preventable, although there is a genetic element in it. Any disease as such matter like diabetes or cardiovascular problems, even osteoarthritis can be preventable, considering we have a very healthy lifestyle.
So how much can lifestyle play a contribute to knee pain?
Yeah, lifestyle has got a direct correlation with our bone health and the joints. Coming to the lifestyle, I would strongly recommend everyone to do at least around 145 to 150 minutes of exercises every week, to have a healthy diet, to include our green leafy vegetables, to avoid alcohol, to avoid junk food or highly processed food, or desserts, what we call, and to keep ourselves active in terms, even if you're working, to do some exercises in between, and to have an optimal weight. The more the weight, obviously it puts more pressure on our knee. So I think having all these things will definitely help on a long run to keep our joints, especially knee, healthy.
That's very interesting. You said, exercise and walk and all that.
Yeah.
So normally what happens is when people start getting knee pain, the first thing they do is stop exercising and stop walking.
Yeah.
So is it advisable to walk? Is it a myth that, what is it like? Can they exercise?
That's a big myth. Many patients ask me as well that I've got osteoarthritis, doctor. Is it safe to walk? They think the more they walk, they are going to wear it out. So the myth is that it has to be busted. The more we walk, we are increasing the strength in the surrounding muscles, and it also helps us to improve the range of movements in the joints. If you don't walk, the joint becomes stiff. So we strongly recommend anybody has got osteoarthritis to keep walking, and if they especially have got some swimming pools or some water bodies nearby, the best thing is to do a swimming, because it's non-weight bearing, it's non-impacting. That's the best exercises for knee arthritis. If they can't swim, and if they have got phobia to get into deep waters, at least walking in the water will help a lot. It will strengthen the muscles, and yes, I strongly recommend anybody who's got arthritis to keep walking and keep mobile.
Doctor, another thing is, now when you're talking about prevention, now that somebody is already diagnosed with osteoarthritis, so how do we know that this person has to undergo a knee replacement surgery?
Okay. Well, not all the arthritis patient need surgery. Surgery we recommend only at the end stage. Once we have tried all the non-operative treatment, all the conservative treatment we call as the end stage or the final stage of arthritis is surgical intervention. The people who have a rest pain, who even struggling to get up from a sitting position, who have got night pain, who are struggling with their day-to-day activities, going to toilet, preparing their dinner, or going to a nearby neighbor's house, and if somebody is taking the painkillers on daily basis, and if somebody has got some deformities in the knees, like bowing of the knees, or if their knees bend, and if they are struggling to even bend their knee, these are the clear indications, clinical indications, and obviously we'll get the x-rays of the knee. If the bone has completely eroded, what we call it as bone-on-bone arthritis, then definitely they need a knee replacement.
So, sir, if somebody wants to get diagnosed with, they want to check if it is osteoarthritis or not, what are some of the recommended tests?
Again, as I told in the beginning, if somebody has got knee pain or arthritis, it doesn't mean it's osteoarthritis. It could be an inflammatory arthritis like rheumatoid, gout, or other inflammatory arthritis. So the best thing to do is consult an orthopedic surgeon or a rheumatologist who are well trained to treat these diseases, get a complete clinical examination, and do some x-rays to start with, which are basic tests, and if there is any suspicion of inflammatory, then do a rheumatoid factor, serum uric acid, and other relevant tests like MRI scan if there is any history of injuries.
Okay.
Yeah, these are the basic tests.
Sir, if somebody wants to get a knee replacement surgery, first thing that comes to their mind is fear. And
Yeah.
there is a lot of negative thing attached to the surgery of the knee.
Yeah.
So could you please talk to us about that?
Yes, I think any surgery we get fear. As soon as we tell the word surgery, it's very normal or natural to have anxiety regarding the treatment. But now we have latest technologies in place. The anesthetic techniques have advanced. So we have got a very good success rate in knee replacement now. So coming to the knee replacement, I think it's a very safe surgery to have.
So at Sparsh hospitals, I'm sure you have done hundreds and thousands of knee
Yeah.
replacement surgeries already.
Yeah.
So if you could tell us what are some latest advanced technologies that you have here, sir?
Yes, we are having a robotic system here in Sparsh Hospital, which is having a very precise determination of cuts. When we take the cuts in the bones, usually what happens is the surgeon decides what's the amount of bone to be cut, what's the angle he needs to take the cut. But in robotic replacement, the advantage is we have a computer system which takes the complete scan of the knee joint and then it determines the cuts. So there is a less soft tissue dissection. We don't need to cut so much of soft tissue to correct the deformity, and even the cuts will be very much smaller, almost half the size of what we cut in a traditional or a conventional knee without using a robotic system. So these are the advantages of.
So with this
having a
kind of
robot.
lesser tissue getting cut, what happens like immediately after the surgery? Can the person walk? So how does it?
Yeah, there are a lot of advantages. One being they have a quicker recovery because we are not cut the soft tissues. They will be able to get back on their feet earlier. There will be less pain, less blood loss, and as I told, the determination of cuts is taken by the robot. There will be no human errors. So we think that the implants which are placed are in perfect alignment as it need to be placed.
Approximately how many hours do you need after surgery to recover from this
Well,
complaint?
most of the times we make them walk on the same day, and if they are in lot of pain or if they are very anxious, it could be on the next day of the surgery.
Okay. So there are multiple ads suggesting that you can take an injection which can help in osteoarthritis.
Yeah.
So does that help actually?
Yes, injection do help. It depends on the stage of arthritis. If there is early arthritis, there are 4 stages of arthritis. Stage 1 is the first one, or the earlier arthritis. Stage 4 is the final or the last stage. If the patient is in stage 1 or 2, where the joint space is still preserved, then yes, the knee injections help. There are different injections basically. We got steroid injection, we got something called platelet-rich plasma, where we take the blood of the patient and they concentrate the healthy or growth factors and inject into the joint. And there is something called as a hyaluronic acid, which is artificial joint fluid, and that also helps. But all this helps only in the early stages. If the stage has gone beyond 3, or if the bone is eroded, the cartilage is eroded up to the bone, then the injections won't help. Steroid just helps for as a pain relief. That's all.
Okay. So when you're suggesting knee replacement surgery as an option, are there any preventive methods or like physiotherapy? What role does it actually play?
Yeah, physiotherapy plays a very important role in any knee arthritis, especially in the early stages. It strengthens the muscles around the knee joint, what is called as quadriceps, the muscle bulk in front of our knee. If the quads are strong, it takes away a lot of weight from the knee joint and it relieves the knee pain. And also it helps us in a very good gait. If somebody has got knee pain, the way they walk is different. They put weight on the other side of the knee, they will hurt their back, they have hip pain, they have got various problems associated with knee pain. But if they have got good physiotherapy, they will strengthen the muscle and it will postpone them having an operation.
Okay. Once operated, sir?
Yes, definitely after operation, again physiotherapy is equally important, because if they don't move their knee, it will become stiff. And if they become stiff, the whole purpose of doing a knee replacement fails. And I think the physiotherapy is equally important after having a knee replacement as the knee replacement itself. So they should have immediate physiotherapy to get a full benefit of having a surgery.
Okay. Sir, are there, like for heart health, we say that these are the tests to be done regularly on a yearly basis.
Yeah.
Similarly, for bone health, are there any tests to be done?
Well, bone health, as I told, healthy lifestyle is equally important, and regular check of serum calcium, especially in the post-menopausal woman. As they attain menopause, their estrogen reduces and it ultimately affects their bone health. So serum calcium, serum phosphorus, and there is something called as alkaline phosphatase, which determines the activity of bone. Along with that, if there is any suspicion of rheumatoid arthritis, then rheumatoid factor, and if there is history of gout in the family, if somebody is taking a lot of alcohol or red meat, then serum uric acid.
What about bone density tests?
Bone density, if there is a history of osteoporosis in the family, if they are post-menopausal, or if they are taking steroid, or if there are any cancer chemotherapy, then yes, definitely this group of patient needs a bone mineral density.
So could you give us some exercises which people with knee pain can do?
Yeah, the very common exercises I would recommend would be walking, which is very easier to do, and even if you have 20-30 minutes, you can still do it, and it gives exercises to the entire body, not just the knee. And other exercises would be to do something called a static quadriceps exercises, where you keep your knee straight. You can do it when you get up when somebody gets up in the night, when it gets up in the early morning, or when they go to bed. They have to keep their knee straight, stiffen their kneecap, and bring their feet upside, and then hold it for 10 seconds. It's called static quadriceps exercises, which strengthen the muscle bulk in the front of the knee or quadriceps. They can either do it supporting their whole leg, or they can do it in a free air, unsupported, which also gives a better strength to the muscles. The other option will be to do a swimming or even walking in the water. We call it as hydrotherapy, which has also got a lot of benefits which strengthen the knee muscles. So these are the exercises I would strongly recommend for any person who has got a knee osteoarthritis.
Is cycling also okay for?
Yes, cycling again is equally important, which again strengthens the knee muscles. Yes.
Okay.
Yeah, stationary or the bicycle taking up the road, both will help.
Doctor, are there any exercises which people cannot do? If you can just list them.
Yeah, coming to the exercises, we call this as impacting activities which will damage the knee joint, like running or jumping, which will definitely cause more harm, and going up and down the stairs sometimes cause more pressure, especially patellofemoral joint, we call, behind the kneecap. That joint will be more affected. Avoid bending your knees, sitting cross-legged, and especially if you're using Indian toilets, it's better to avoid that, where you squat, and that puts more pressure on your knee. And I think these are the activities we would strongly recommend not to do, which enhances the earlier wear of the knee joint. Yeah.
So one last question I have, if you can give us 5 tips for a healthy knee.
5 tips, yes. One is obviously, as I told, a healthy lifestyle, which means having regular exercises, having a good diet, avoiding alcohol, red meat or junk food, and avoiding any injuries, which is very difficult, but yes, if you injure your knee, then definitely you are prone for further consequences like arthritis, and maintaining a healthy weight, because lesser the weight, it puts less pressure. I think these are the very important tips or messages I would like to give.
Thank you very much, Doctor. It was wonderful speaking
Thank
to
you.
you. Thank you.
Awesome.